I'm Judy McClain-Williams. I'm 82 years old, and I moved to the Arlington area to be near my daughter into a retirement home. And she introduced me to her doctor, Dr. Schum Brady. And she taught me the most I know about drinking water, and I'm now a solid citizen drinking water all the time.
Well, good. Well, and I am Dr. Schum Brady, and I practice general medicine here in Arlington, Virginia. And I have known I tripped across the knowledge of water. When I was doing general medicine in D.C., I saw that there was scant urine in the cups, the testing cups, and it was very dark. And then I realized I must be seeing some of those patients. And so I started to go in and ask my patients, how much water do you drink? Well, ask yourself, how many times does a doctor ask, how much water do you drink? And my patients would say, nobody's ever asked me that before. And many of the patients would say, I don't drink water, which surprised me because I've always been a water drinker, so it never occurred to me that people wouldn't be. But so it was a natural step from that question to looking at their diseases to seeing what would happen to their diseases if we just added water. So, do you want to tell them about some of your medical problems and what's happened to them with the water?
All right, I have type 2 diabetes. I'm overweight. I need to diet. I was in a car wreck and had lots of things that happened because of that. Even colds and things like that. Well, she got me to drinking water. She asked me that question when I got here. She had just taught my little granddaughter, who's a tennis player, who was not drinking water, that she'd play better tennis if she did. And so she's absolutely phenomenal. She's at Chris Everett Tennis Academy. That was the first inkling. Then I started adding water, like she said, and she told me I needed half my body weight in water. Well, that sounded astronomical to me. And I began to try to figure out all kinds of ways to drink that much water. And now I've got it down pat. I drink 16 ounces before I go to eat any meal. And then during the meal, I drink a glass of water. Then when I get my snack in the afternoon, I drink another 16 ounces, and I drink 16 ounces during the night. Well, what I found out about this is, it seems to regulate me. You can set your clock by me. I wake up every night between 3:10 and 3:15, to have my nightly trip to the bathroom. And I laugh every night because it's right on the button. And in the morning, I have the same my body is organized. And she taught me about how much water is in all your organs. And I got to thinking, how can you possibly function if they don't all have their water?
That's right. So how's your thinking?
It has changed my life, literally. And I'm talking water all the time. And I was talking to a lady at breakfast this morning at the retirement home. And she says, I don't ever drink water. And I told her the same story I just said. We have to drink water. Our brains are 85% water. Imagine a deprived brain, what it can do when it gets water, and a deprived kidney, and a deprived everything. And I'm going to a gym now, and my muscles, I drink water, more water than ever when I go there, and it's just, I'm 82 and I feel like I'm 16.
And some of your aches and pains went away?
They're gone. They're just gone. The status of my type 2 diabetes has improved drastically, and I've gone off of 4 medicines.
And how about your high blood pressure?
My high blood pressure is also very good.
And your skin?
And my skin is beautiful. Because I had 2 skin cancers up here, and you can't see them. Everything about me is moist. You know, she taught me that water would make my skin look better. And people over at the retirement home, they want to know how I get such skin. Well, I tell them it's water, and they don't believe me, but maybe I can tell them about this hydration thing, and they will.
Well, I tell my patients, there's always something I can tie water to. So if people are athletes, they want to recover quickly from their, they want their muscles to recover, so water will help that. But if for those of us who are vain, drinking enough water will take about 10 years off of our skin. So for those of us who want to be healthier, drink water, and you will look healthier, and you will feel healthier, you will think healthier.
Another thing I found out is I recuperate lots faster. I think, in my dieting, I think the water just takes the sludge right out. And I've never known that it would do that before. So when I lose a little bit of fat, out it goes. And I thank God for this lady. People need to find a doctor that believes in water.
Well, it's not hard to stay healthy. Our bodies aren't made to work on prescriptions. They're not even made to work on supplements. They're made to work on basic good food, and the most important ingredient in our good diet is water. And we know that you can't live very long without water. We can live a long time without food, but we can't live very long without water.
It's improved my eyes. I don't know how it does that, but the same way it does with everything else. I'm 82 years old, and for the first time in my life, I'm not wearing glasses. I had a cataract removed and a new lens put in, but my eyes are healthy. But the doctor told me that they were very healthy eyes.
But cataracts are due to not enough water. The lenses
Are they really?
The lenses on the eyes have to be hydrated. So if the lenses get dried out, then they cloud over and cause cataracts.
I had a large cataract, but can you imagine how I feel? I'm going to buy some mascara.
That's good. That's good. And you're proselytizing over at your
all the time.
senior citizen home.
She's going to come speak to us about this water business.
Well, there isn't a part of the body that I can't talk about in relation to water. Whether it's your skin, whether it's hair and dandruff. I mean, anybody with a skin problem has a water problem. And I'm not trying to say that water will fix everything, but water is part of every solution. And so it doesn't matter how good our medicines are, if we don't have enough of the basic ingredients going into the body, the medicines won't work anyway.
Another thing I found out is that, that type 2 diabetes people have any kind of little wound takes a longer time to heal. Well, mine heal fast now. And I guarantee you it's water that does it. My foot that y'all were worried about, you ought to see how nice it is.
Well, you should wait and hear
like-
the story of the next guy whose foot looks much better.
Oh, how wonderful. Well, I'm the editor of a paper at Chesterfield, Chesterbrook Residences. It's a lovely home for the elderly. It's called Active Assisted Living, and it's a beautiful place, and I'm the editor of the newspaper. It's called the Chesterbrook Chatter, and I want to put something about this in there so all these people can read it, because I can pick them out at the tables. I go sit down at every table every morning, and I talk to people, and several of them say, "Oh, I don't drink water at all," and I tell them why they need to drink water. And I'm going to get the food guy to put a big thing of water on every table. Wouldn't that get him to drink it better?
So I'd say she's a convert, wouldn't you?
I would too.
Oh, this is what, and my little old beautiful granddaughter. Of course, my daughter's always been she's the one that told me about this doctor when I moved here.
So
First thing she did was take me off of 4 medicines, and I'm just trying.
well, I can't take you off of medicines unless we solve the problem.
We will solve
And
the
the
problem.
problems, and so as we solve the problems, you have too much medicine on board. So we have to do whatever we do. We have to do it very conservatively. So you can't be more conservative about your health than drinking water,
No, that's right.
and more avant-garde either. Okay.
We are avant-garde, girl.
Oh, there you go. Do you have anything else you want to add before he
Just
turns off that
thank you,
machine?
Thank you, dear lady.
Okay,
And
thank
you
you.
too.